Hello everyone. Today I'll be presenting my case evaluation project. My name is Carla Moreno. For confidentiality purposes, this client's name has been changed to Carlos Montero. During this presentation, I'll review the client's background, presenting concerns, treatment goals, evidence-based interventions, measurement strategy, treatment outcomes, and my evaluation of the effectiveness of treatment. I'll also discuss how standardized outcome measures were used to monitor progress and how evidence-based practice guided clinical decision-making throughout the therapeutic process. So, Carlos is a man in his 50s who entered outpatient treatment while living in a sober living facility. Although he's currently separated from his wife, he remains motivated to repair those relationships and reconnect with his family. He has 3 daughters and hopes that maintaining recovery will allow him to become a more active father and husband. Clinically, Carlos presented with 3 primary diagnoses: alcohol use disorder, post-traumatic stress disorder, and bipolar disorder, primarily depressive type. He was already connected with psychiatric services and taking prescribed medications, but continued experiencing significant symptoms that affected his daily functioning. His overall treatment focused on maintaining sobriety, improving psychiatric stability, reducing trauma symptoms, and helping him build a healthier and more meaningful life. Carlos presented with multiple co-occurring disorders that interacted with one another and created significant barriers to recovery. First, he experienced severe PTSD symptoms related to both his childhood abuse and military trauma. These symptoms included nightmares several nights each week, intrusive memories throughout the day, hypervigilance, and emotional reactivity. He also struggled with bipolar disorder, primarily characterized by depressive symptoms such as low motivation, fatigue, decreased interest in activities, and difficulty functioning day to day. In addition, Carlos had approximately 25 years of alcohol use disorder. He described alcohol as his primary coping mechanism for managing painful emotions and trauma symptoms. Although he had periods of sobriety, his longest sustained recovery had only been 6 months. Other challenges included chronic pain, poor sleep, and intermittent suicidal thoughts, all of which increased his overall risk and required ongoing monitoring throughout the treatment. When looking at Carlos's case from a biopsychosocial perspective, it became clear that several factors contributed to his current difficulties. His childhood was marked by physical and emotional abuse, as well as exposure to domestic violence. Later military experiences added another layer of trauma that contributed to his chronic PTSD symptoms. These experiences, combined with chronic physical pain and bipolar disorder, increased emotional distress and made alcohol an unhealthy coping strategy for many years. Despite these challenges, Carlos also had several strengths that supported treatment. He was living in a structured, sober living environment, attended approximately 5 recovery meetings each week, worked closely with his sponsor, remained compliant with psychiatric treatment, and demonstrated genuine motivation to improve his life. Recognizing both risk factors and protective factors helped develop a treatment plan that focused not only on reducing symptoms but also on strengthening existing supports and building healthier coping skills. After completing the assessment, I collaborated with Carlos to develop both short-term and long-term treatment goals. Establishing goals together helped increase his engagement and ensure that treatment addressed what was most important to him. The short-term goals focused on stabilization. These included maintaining abstinence from alcohol, identifying personal triggers for both substance use and trauma symptoms, improving sleep, practicing coping skills during periods of distress, and remaining compliant with psychiatric medication and appointments. The long-term goals focused on sustained recovery and improving overall functioning. These goals including maintaining at least 6 months of sobriety, reducing PTSD symptoms such as nightmares and hypervigilance, improving mood stability related to bipolar disorder, developing healthier emotional regulation skills, and eventually obtaining stable employment. These goals address not only symptom reduction, but also improvement in his quality of life and long-term recovery. 2 primary evidence-based interventions were used throughout treatment: cognitive behavioral therapy, and seeking safety. CBT was used to help Carlos recognize the connection between his thoughts, emotions, and behaviors. Treatment focused on challenging negative beliefs developed through trauma, increasing healthy activities through behavioral activation, and strengthening relapse prevention skills. We also practice identifying situations that increase cravings and replacing unhealthy coping strategies with healthier alternatives. Seeking safety was especially appropriate because Carlos had both PTSD and substance use disorder. Unlike trauma processing therapies, seeking safety does not require clients to relieve traumatic memories. Instead, it emphasizes helping clients establish safety in their daily lives while developing practical coping skills. Some of the topics covered included grounding techniques, emotional regulation, healthy relationships, setting boundaries, and taking back personal power. Carlos reported that grounding exercises became one of the most helpful strategies for managing intrusive thoughts and reducing emotional distress. Together, these interventions addressed both trauma symptoms and substance use simultaneously, which is supported by research for individuals with co-occurring disorders. To objectively monitor treatment progress, I selected the PTSD checklist for DSM-5, commonly known as the PCL-5. This is a standardized 20-item self-report measure that assesses PTSD symptom severity according to DSM-5 criteria. Clients rate how much they've been bothered by each symptom over the previous month. I administered the assessment at intake and then every 4 weeks throughout treatment. This allowed me to objectively monitor changes in symptom severity rather than relying only on clinical impression or client self-report. The PCL-5 is a widely recognized, reliable, and valid instrument and is commonly used in both research and clinical practice. Regular outcome monitoring also allowed treatment to remain flexible. If scores had not improved, we would have modified interventions or explored additional barriers to progress. Using standardized measures is an important component of evidence-based social work because it combines research evidence with clinical judgment and the client's own experiences. So in this slide, you can see the PTSD checklist for DSM-5 or PCL-5, the assessment that I was referring to in the previous slide. So this is the standardized measurement tool that I use throughout treatment. The assessment consists of 20 questions that measure PTSD symptom severity over the past month. Administering the PCL-5 at regular intervals allowed me to objectively monitor Carlos's progress and evaluate whether the interventions were producing meaningful improvements. The PCL-5 results showed consistent improvement throughout treatment. At intake, Carlos scored a 59, indicating severe PTSD symptoms. After 4 weeks of treatment, his score decreased to 50, suggesting that early intervention and increased engagement were already having a positive effect. By week 8, his score decreased again to 41. Around this time, Carlos reported experiencing fewer nightmares, less emotional reactivity, and greater confidence using grounding techniques during stressful situations. At discharge, his PCL-5 score had decreased to 31, representing a clinically meaningful reduction in PTSD symptom severity. These objective findings were also supported by improvements in his daily functioning. Carlos maintained sobriety while living at the Sober Living House, attended approximately 5 recovery meetings each week, remained engaged with a sponsor, improved his sleep from 4 to 6 hours per night to approximately 6 to 7 hours, and demonstrated greater insight into his triggers. Although PTSD symptoms were still present, they occurred less frequently and were less intense. Most importantly, Carlos was increasingly able to manage distress using coping skills instead of alcohol. This demonstrated meaningful progress towards both his mental health and recovery goals. Overall, treatment was effective in helping Carlos make meaningful progress towards his goals. Throughout the 12 weeks of treatment, he maintained sobriety while living in a sober living environment and remained actively engaged in his recovery by attending support meetings each week and working closely with a sponsor. His PTSD symptoms also improved substantially. Objective data from the PCL-5 showed a steady decrease in symptom severity over time, and these improvements were reflected in therapy sessions. Carlos reported fewer nightmares, fewer intrusive thoughts, and less emotional reactivity. He also became more confident in using coping strategies such as grounding techniques instead of turning to alcohol during periods of distress. Another positive outcome was improved mood stability. Through medication management, CBT interventions, and behavioral activation, Carlos became more engaged in meaningful activities, including applying for employment and reconnecting with his supportive family members. Although he continued experiencing chronic pain and occasional trauma symptoms, these challenges became much more manageable because he had developed healthier coping skills and stronger recovery support system. Despite the positive outcomes, there were several barriers that made treatment more challenging. Carlos had experienced significant trauma throughout his life, continued struggle with chronic pain, and frequently encountered emotional triggers related to family relationships. These factors sometimes reduce his motivation and increase his vulnerability to relapse. From my perspective as a social worker, one of the greatest strengths during this case was building a strong therapeutic relationship. Establishing trust allowed Carlos to openly discuss difficult experiences, which increased his engagement throughout treatment. I also believe that regularly using standardized outcome measures strengthen clinical decision making. Rather than relying on observation, I was able to objectively monitor progress and adjust conversations based on measurable improvements. If I were to continue working with Carlos, one area I would strengthen would be involving family members in treatment whenever appropriate, like his wife. Because rebuilding family relationships was one of his primary goals, additional family sessions could have improved communication, strengthened his support system, and promoted long-term recovery. This case reinforced several important lessons about clinical social work practice. First, clients with co-occurring disorders benefit from integrated treatment approaches that address substance use and mental health simultaneously rather than treating each problem separately. Second, evidence-based interventions such as CBT and seeking safety can produce meaningful improvements when combined with collaborative treatment planning and strong therapeutic relationship. This case also demonstrated the importance of routine outcome monitoring. Using the PCL-5 allowed me to objectively evaluate treatment effectiveness while also helping Carlos see his own progress over time. That objective feedback became a source of motivation throughout the treatment. Finally, recover is about much more than reducing symptoms. Carlos not only experienced fewer PTSD symptoms, but also developed healthier coping skills. He also improved emotional regulation, strengthened his recovery network, and increased hope for rebuilding his family relationships. Overall, this experience reinforced the importance of combining evidence-based practice, standardized assessment tools, and individualized client-centered care to promote long-term recovery.